Hi, and welcome to How Humans Heal. I'm Dr. Donnie Wilson, host of How Humans Heal, and I'm so glad you're here. Please make sure to hit the subscribe so that you hear from me when I release new episodes. Today's episode is focused on how to heal HPV. What we're talking about is actually how to get HPV to negative and how to heal the abnormal cells caused by HPV. Most often, this is happening for women who receive abnormal pap smear results. Could be abnormal cells on the cervix or the vaginal or vulvar cells. Even rectal cells can become abnormal because of the HPV virus. And I'm passionate about this because I know that we can prevent cancers of these areas of the body by helping you protect yourself from HPV way before it has a chance to cause cancer cells, or if you already had cancer from HPV and it was treated, now we got to prevent it from coming back again. This is something I've been helping women and men with in my practice for over 2 decades. And so I have so much experience and so much information to share with you. I wanted to make sure that you got to listen in to the free masterclass I gave recently, because this is something that is so important, I feel, to inform as many people as possible. So if you know anyone who's been tested positive for HPV or struggling with abnormal pap smears, please share this with them. And I look forward to your questions and comments and reviews as well for this episode and all the other episodes of How Humans Heal. Thank you so much. So, hi, I'm Dr. Donnie Wilson, and I am a naturopathic doctor. So, I went to a naturopathic medical school called Bastyr University. I graduated in the year 2000. So now it's the year 2022, and I've been practicing ever since. I'm also trained as a midwife. So I've always specialized in women's health. And I also do help children and men in my practice, but a lot of my focus and my interest has been in particular having to do with women's health. And so I want you to know that, because I know you can get all kinds of different information out on the internet. And I feel like it's important to know who you're listening to, right? Where is this information that I'm sharing coming from? And so I want you to know it comes from my clinical background, my training, and research, and what I've learned over the years. This is the thing, is I've been helping women with their health in general, and I want to especially highlight HPV and abnormal pap smears today. So I've been helping with that for even while I was in my training, so over 22 years. And so I want to be able to share that information. This is the thing I learned from all of those years, is that this information is so needed, and many people and women are not getting this information. And my patients, once I help them, they're always begging me to put this information out to more people. So this is what inspires me to do a video like this, is to just put the information out there so that I always feel like when we have information, we can make better decisions, right? We can make decisions about our health, and we can be our own advocates for our health when we have information. If we don't have information, we're in the dark, we're in the mystery, we're in the confusion, and it's hard to make any kind of decisions from that place. So this is one of the main things today, is I want you to be able to have information so that you can make decisions. And you'll see that the way that I present things and set things up in my practice and in my business is to give you options, because I want you to be able to listen to yourselves and your own intuition, and then choose what feels to you like is going to help you most, right? So it's a matter of having the information and listening to yourself so you know which solutions and which support to choose for you. So that's our goal today, is to be able to help you with that process. So I'm going to share my screen so that I can share some slides, although I also will be coming back, because I know it can really help to, to not be constantly looking at slides. So, but let me hit play on these so you can see them. And so one of the keys is, first of all, just for you to understand HPV and your pap smear and what it all means. These are some of the common misconceptions. And I think sometimes this is a great way to just break through and kind of go, okay, let me set these misconceptions aside. So a lot of times there's this perception that like when you get your test result back that says HPV, it's such a shock, right? It's like, how did this happen to me? Why is this there? And it feels like you're 1 in a million, but actually you're not 1 in a million. HPV is very common. In fact, they say that most all of us are exposed to it at some point in our lives. So it's not a rare virus. It's quite a common virus. And there's also sometimes this perception that it's only women who have multiple partners or, maybe, sort of like more high risk behaviors that get HPV, but that's not true. It's pretty much anyone can get HPV, even with a single sexual partner. It's also not true that there's only one type of HPV. Maybe some of you have heard on your results that there can be a couple different high risk types, but really there's over 120 different strains of HPV. And we've identified a few of them that are more likely to be an issue, more likely to cause abnormal cells on the cervix, for example, and other areas of the body. So I just like to point out, we talk about it as it's a singular HPV, but actually it's multiple different types of HPV. It's also thought, and this is what you'll mostly hear in the conventional doctor's office, is they don't talk about treating HPV because there's no medication that you can take. There's nothing they can prescribe. Now, there is the vaccine that can be somewhat protective to certain strains of HPV, but if you already have those strains of HPV, then it's less effective. So, really, the doctors talk about it as if there's really not any treatment, and they don't even try, right? They're not going to necessarily try to help you treat HPV. But what I've found over the years is that my patients are able to get their HPV result to negative and keep it that way. So it opened my mind to the possibility that it's possible to get HPV to negative and get rid of it out of your life forever, because that's what I've seen in my practice. So that's why I want you to know that it's possible. So again, here's some more facts about HPV. And here you see 80% of women will acquire it by age 50, so you figure, okay, this is something that we as humans, in particular, I think it's for men also, but I'm highlighting women, pretty much this is something in our environment, in our exposure. So it's a matter of thinking about it differently. I really encourage you to shift your thinking away from exposure, right? Like so many women I talk to, it's very common to get caught up in, how did I get this virus? Was it that relationship? Was it this relationship? Was it from my past relationships? Was it from my partner's past relationships? And so our mind wants to distract us with all of these thoughts. So I want to encourage you to just notice those thoughts and remind yourself that it's really not so much about how or when you were exposed. What's more important at this moment in time is how you're going to get rid of it, right? Because most all of us are exposed to it. And there's a delay. You could be exposed 20 years ago and it didn't test positive until now. So you will never know whether it was a recent exposure, past exposure. There's no answers. So if we can't get that information, it's not worth you worrying yourself about it. Better to just put all your focus on, how am I going to help my body fight it off? How do I help my body fend off this HPV and get rid of it? Because that's where your power is. That's where your control is. That's where you can do something about it. And actually what I'm going to be teaching you is, by the time you learn how to help your body fend off HPV, you've already improved your overall health. If you're trying to get pregnant, you've already improved your fertility. If you're trying to prevent other health issues like cancer, heart disease, dementia, you're already going to be doing that by fending off HPV, because the way to fend off HPV is to get your body as healthy as possible. And I'm going to show you how I've found best to do that. So this is just to clarify about the different types of HPV and how some of them cause genital warts and some of them can increase risk of cancers. Some of them can increase risk of cancers in different areas of the body. This is an example case that I worked with who says, I was so stressed when I first called Dr. Donnie. So I want you to know you're not alone. Most people who call me are feeling like, what am I going to do about this? She had found me online and she didn't know who to trust. So she's saying, working with Dr. Donnie changed my life. Not only did we get my pap to negative, but she helped me get pregnant and have a healthy baby. And I just wish more women knew about this option. So this is what I'm saying to you. Like, my patients end up saying to me, please tell more people about this. And this is the other thing about HPV is it can happen at different ages, right? It's not just women in childbearing age. It can also happen peri and postmenopausally. And a lot of women will ask me, well, does your protocol work for if I'm over 50 years old or if I have different types of HPV? And my answer is yes. My protocol has worked on all different age groups. It has worked for different, HPV 16, 18, you name it, every different type of HPV, it will work because we're getting to the core, right? We're not just using a kind of a quick fix cover up, which you'll see online. I see it all the time and people report it back to me. There's a lot of marketing schemes out there that will sell you products that are like maybe a quick fix is what I would call it. Maybe it's going to work, or maybe it's not going to work. Maybe it's going to work temporarily. I'm in the game of wanting long-term solutions that are deep, lasting solutions, right? So I'm in a way different perspective and realm than a lot of what I see out there talking about HPV. These are some of the other common questions I hear. And HPV really isn't known to have symptoms per se, unless there's a genital wart. Some patients do tell me that they notice, maybe sensations vaginally or discharge, or, some women are more in touch with certain symptoms in their body that indicate HPV, but it's not known to cause certain symptoms, which is actually part of the issue because sometimes you don't know you have it until you get the pap smear done, right? That's why it's so important to do the pap. Now, here's the thing. The pap is really looking at the cells on the cervix. It doesn't include an HPV test just in the pap. The doctor has to order a separate HPV test. So when you go in for a pap, make sure they're doing both the pap and the HPV test. Now, years past, decades past, they a lot of times they only tested for HPV when you had abnormal cells. But I'm seeing more and more now and around the world, because I talk to women all around the world, and I see pap results from around the world from different clinics. More and more, they're automatically testing for HPV when they do a pap. But I just want to mention it to you because in case you didn't know that already, you have to ask them to do both a pap and HPV for women. And they don't have a screening test for men. There are some, both for men and women, there are some kind of do-it-yourself online test kits for HPV. But it's, that's the thing is women are getting screened because of this risk for cervical cancer. And men are not so much being screened for cancer of HPV until usually if the cancer develops, that's when they usually find it. And so, a lot of times when I'm helping women with HPV and abnormal pap smears, I might also be helping their partner if their partner is wanting to also fend off HPV. So I'm going to show you a little bit more about how to interpret your pap smear results, because I want you to have a sense of it. And I feel like this is so important for you to, first of all, contact your doctor's office if they didn't give you the report and ask for your report. Call and say, I need a copy of my pap report, or if you had a colposcopy, ask for the colposcopy result so that you have it in your hands. You have it in your folder so you can keep track over time. They don't always just give it to you or send it to you. So you have to sometimes ask for it. And this is the thing is I like for you to start to have this information, because then if you contact me, you're going to be able to tell me and communicate, here's what is going on. I have this HPV, or I have this level of of dysplasia. Dysplasia means abnormal cells. I'm going to show you about that here too. So we talked about there's not really standard symptoms. Here's how you test the pap smear and the HPV test. So they do, this is what the pap smear kit will often look like. They put the cells on a slide. So let's look at these results. What do they look like? What you really want, and I like to give you these words because then if you're looking at your result, you know what you're looking for. And this is also what you can use in your guided imagery or in your meditation. So you know you're looking for satisfactory for interpretation. That means they got enough cells. You're looking for endocervical cells present because they need to test the face of the cervix and the right inside the endocervical canal. You want to see if they saw any abnormal cells and if they saw any HPV. So here's an example, for example. And again, I see results from around the world and they all look different. I don't know why. These labs all just kind of look a little bit different when you see them. But this one, for example, is saying, adequate, satisfactory, they got the right cells. Then it says atypical squamous cells of undetermined significance. This is something we call ASCUS, ASCUS. And this is the most mild form of abnormal cells. It actually is a type of inflammation on the cervix. It's not always caused by HPV. ASCUS could be caused by hormonal changes, by yeast or BV, and other causes. So ASCUS is not specific to HPV, and it means just those cells on the cervix are a little bit stressed out. We still want to help your cervix heal. And this is another key piece, is the cervix can heal. The cervix has cells on it, just like you have cells making up your skin. And we know that our skin sloughs and we grow new skin all the time. Same thing on the cervix. It can grow new healthy cells. So if we give your body the right support, it can grow new healthy cells. So we just want to know what degree is the abnormality first. And so they use the naming of a CIN1, 2, or 3 to grade the degree of severity before it gets to cancer, right? Carcinoma in situ is the step before cancer. So it's really better if you can catch it early. If you can catch it at CIN1, even CIN2, CIN3, then we can get rid of those abnormal cells. And then the key is once you've gotten rid of the abnormal cells, we got to prevent that virus from causing it to happen again. Because a common sort of, I don't know, I want to say trap or misconception that happens for women is they treat it maybe first with a LEEP procedure, which is a laser procedure to remove the abnormal cells, right? Here's if you have CIN2 or 3, they will recommend a LEEP, or it has different names in different countries, but it's essentially a laser treatment to remove the abnormal cells. Or if it's more severe, they may need to do what's called a cone biopsy, which is removing part of the cervix. So they're going to want to remove that. But even then, after that, it could happen again. Like I have women I talk to a year later and they're back again with CIN2 or 3 again, or they had cancer, even the cancer was removed, and a couple years later, it comes back again. Why? Well, because the virus is still there and active, and the virus can still cause abnormal cells. And whatever made you susceptible to this the first time, if it hasn't shifted, you're still susceptible. It could happen again. And so my role, what I feel is my job, is to help you understand why. Why are you susceptible? Why is that happening? How do we get it so that it doesn't happen again, so that you can get out of this whole situation? And what I mentioned on this slide is there is an alternative to LEEP for CIN2 and 3 called Escarada Treatments, which is something that I offer through my office. So if you're deciding, should I have a LEEP? I don't really want to have a LEEP, or I don't want to have another LEEP. Is there something else I can do? Yes, there's something called Escarado Treatments, and it's a treatment directly on the cervix using herbs and nutrients, and it can be done in the office or at home, and it takes 10 treatments, so it's usually twice a week over 5 weeks to do all 10 treatments. So it's intensive, right? It takes time and to do it, but it definitely can remove the abnormal cells. The problem, the thing that women usually are concerned about is that if you have to have a leap or a cone biopsy, it can damage the cervix. So if you're planning on a pregnancy or you really don't want to damage your cervix, that's when Escarada might be chosen as a way to remove the abnormal cells without damaging your cervix. I just want to show you this kind of cool picture of, so again, the visual can help. This is on the left, what normal healthy cells of the cervix look like. They're these nice shape. They have a little small nucleus in them. As they become more abnormal, and this is most often caused by HPV virus, then they start to get different shapes and the nucleus starts to change. And this is what the pathologist sees when they're looking at your pap smear. They start to look, just different. And those different cells are starting to go toward what is known to be a cancer cell. So we want to catch them before they get there, right? So I think we got covered this part. You understand the HPV. If HPV is positive, it could potentially cause abnormal cells. So here's the thing is the research shows that 90% of people who were positive for HPV, in 90% of people, it will go away on its own within 2 years. So this is often why your doctor might say to you, come back in a year. Let's see what it looks like in a year. Because if it's, they're not going to say that if it's CIN2 or 3, but if it's an ASCUS or if it's CIN1, or maybe it's just positive HPV and no abnormal cells, they might say to you, come back in a year, because they know that there's a high probability that it might just go away on its own. The issue is that a lot of women are not comfortable with that, right? Like you might be like, what do you mean? I have a virus that can cause cancer and I'm supposed to just calmly wait around for a year and find out if it did, right? Like most women I talk to are like, I would rather do something. I would rather do some diet changes, take some supplements. I'd rather work on my health, balance my hormones. I'd rather do something versus nothing and make sure I'm in that 90%, right? Like that's the way to think about it is we want to make sure you're in the 90% where it goes away. And maybe we can even increase that percentage, right? That's my goal. Let's get it to 100% of people it clears in 2 years, right? That's my mission. But right now they say it's 90%. And we want to be a part of, we want to make sure you're in that 90%, because if you're in the 10% where it doesn't go away on its own in 2 years, then that means you're in the group where it might be causing abnormal cells. It might be causing cancer. Right? We don't want to be in that 10%. We want to be in the percentage where it goes away. And we want to help it go away, right? If there's things we can do, we want to do them. So that's, sometimes that's a good way to kind of think about, okay, what am I doing here? I'm making sure that it goes away. And yeah, sometimes it could go away on its own without you doing anything, but we don't know. It's hard to know that unless you've already spent 2 years doing nothing and it's still there, then that didn't work. And you're like, okay, now what? Okay, so we covered this already. I do like to mention that HPV is not known to cause risk to, like if you get pregnant when you have HPV, it doesn't cause harm to the baby. So that's an important. Other viruses can be an issue for during a delivery, like HSV, but and I also like to mention that I don't think you necessarily have to stop having sex, like say with your partner, because you already both have been exposed. To me, it's not about being re-exposed. Like a lot of women say, well, if I have sex with my partner and they have HPV, are they going to give it back to me? It doesn't work that way. It's already in your system. So it doesn't matter if you're re-exposed. What matters is helping your body know how to fend it off. It's really your body can fend off HPV when we teach your immune system and we figure out why your immune system wasn't doing a good job of fending it off to begin with. So it's really about understanding susceptibility, which I'm going to cover here in a minute. So your doctor may say, let's, come back in a few months, 3 to 12 months, let's recheck. You may need to do a colposcopy, which is a biopsy of the cervix where they are taking a closer look at those cells because the pap is a screening. They want to do a colposcopy to be able to really specifically identify if there's abnormal cells. And some doctors will even sometimes mention a hysterectomy, especially if it's advancing to cancer cells. And sometimes they're mentioning hysterectomy if you're over 40 years old, over 50 years old. But really, the guidelines have changed, and the guidelines are suggesting that doctors be less likely to recommend hysterectomy. So I hope that starts to shift, but those are new guidelines. So they still might be mentioning hysterectomy to me. And a lot of women end up feeling very stressed after talking to their doctor, because sometimes they're it's almost coming across like they're scaring you about cancer, which of course is important. We all know that we're talking about risk of cancer here. So we're concerned. There's a place where you want to be concerned and proactive versus just being pushed into a state of fear, which I think is counteractive. So my goal is also to help you to shift out of fear and into empowerment. How can you feel empowered about your body's ability to heal? They might not tell you that once you have one colposcopy, they're going to need to do another colposcopy, because they're going to need to compare one biopsy to another biopsy. And so you can get into this pattern where you have to have another colposcopy and another colposcopy. And at a certain point, you're like, how do I get out of this? How do I be off of this whole repetitive colposcopy situation? It's also important to know that the procedure, like say they remove the abnormal cells, it doesn't kill the virus. So the abnormal cells can come back again. And sometimes that leap and cone biopsy can damage the cervix. So that's why, it's important to know that there's other ways to address this and prevent this from being, an ongoing situation. Your cervix can heal. I mentioned that already. You can get your body to learn how to fight off this HPV, even if you're re-exposed. And there is an alternative for addressing CIN2, which is the Escarada, which I mentioned. And definitely, if you're in that situation, I encourage you to reach out to my office. Andrea could even, I think she has a link to what I call a get to know you call. And my get to know you calls, this is a free 10-minute call where you would submit your PAP or colposcopy results so I can really see what's happening. And you and I have a quick conversation about what's been happening for you. What have you, what's been the treatment so far? And I can then share with you how best I can help you. Is it by working with you one-on-one? Is it by maybe joining one of my online programs? How can I help you to solve this? Because it definitely can be solved. Let's talk about what's making you susceptible, because that's, to me, one of the key ways about solving this is understanding why this virus has the potential to cause abnormal cells. And by the way, it can cause abnormal cells on the vaginal cells, rectal cells. So some of you listening may also be in a situation where you're not tracking the cervix cells. Maybe you're tracking the vaginal cells. And my protocol works on all of those. I've worked with all different scenarios, all different cases, and they've all been able to resolve the abnormal cells and the HPV. Some of these susceptibilities you've probably heard of, like cigarette smoking. But a lot of women I talk to in my get to know you calls and in my programs and working one-on-one, they say to me, hey, I'm a pretty healthy person. You might already be eating healthy. Maybe you're not smoking. Maybe you were on the birth control pill, but you stopped the birth control pill. And you're like, I don't understand why this HPV is still here. So these are some of the first things we're going to consider, but we got to dig deeper. Are there some hormone imbalances, estrogen, progesterone, or even blood sugar, insulin imbalances? Are there nutrient deficiencies like folate, but also there could be iron deficiencies or others? Is there gut issues? Because what I've seen is that a lot of these cases, now again, I'm talking about, usually I'm working with the people who they're in the 10%, right? Maybe they tried to eliminate this themselves and it didn't go away. And so now they're dealing with abnormal cells and they're saying, what else do I have to do? And so we dig deeper and we go, oh, there's also gut issues. There's also food sensitivities, leaky gut, imbalanced gut bacteria. Some of these women have recurrent bacterial vaginosis, yeast infections. So we start to see there's other factors going on. It's not just the HPV. And even if you have a healthy diet and exercise, this virus might still be able to cause abnormal cells because of these other issues that need to be addressed, including if you have the MTHFR gene variation. And I also feel that the anxiety and shame and stress created in this situation also make you more susceptible. HPV loves it when we're stressed. When we're under stress, HPV thrives. So we need to figure out how, and it's not to try to dismiss the stress of the situation. I know it's a real thing, this HPV, and it could cause cancer cells. So it's a real deal, but how do we manage it in a way where we don't create more anxiety and stress? Because if you're stuck in a state of stress, it's only going to allow the virus to perpetuate, right? We don't want that. We want to help you work through these anxieties and stresses of, how, and I'm sure some of you are feeling this, is this going to ruin my life or my relationship, or, how do I, talk to my partner or not? I mean, these are all these different stresses that come up. And so, if we can help you be proactive with a strategic plan, you're going to be able to move beyond all of this and shift your life for the better. Really, they do show that it can have such a, this is saying psychosexual impact. This is a study that showed, such a stress in relationships, in women's sex life, in just even relationship with themselves with dealing with this. So I want to help you to be able to focus on helping your body become resilient. A lot of times I say 100% resilient. How do we get you to be where your body knows how to deal with this virus and it doesn't have the ability to cause abnormal cells anymore? So this is another case, where she worked with me over 3 months, and we were able to really look at her whole body. We got to look at the hormones. We got to look at the nutrients. We also, in her case, used Escarada treatments on the cervix because she had, I think, CIN2 or 3, and we used vaginal suppositories. I'm going to tell you more about the vaginal suppositories. I have them custom made so that they are using the traditional herbal and nutrient formulas for helping to fend off HPV and heal the cervix. So we use the vaginal suppositories we can use for, even if it's just HPV or if it's ASCUS or CIN1, 2, or 3, we can use the vaginal suppositories. Even if you already had a leak and now you're wanting to fend off the virus, we use the vaginal suppositories along with the oral supplements. And we look at your whole body to shift this, right? So she's saying she got her results to negative, and she's living ecstatic proof that the impossible is in fact possible. Not only have my pap smears been normal, but the HPV is gone, and this is at least 10 years ago. So it's still gone after all of this time. So I want you to know it stays that way. I don't want to just give you something that works for 6 months. I want to be able to help you have this be a lasting approach. So how do you become 100% resilient like that? How can you be like her case? Well, we need to look at how stress is affecting you, right? This is what I was mentioning. HPV loves stress. So we need to help you recover from stress so that you're stress resilient, which is going to help you be HPV resilient. We need to use your food as medicine and figure out the best diet changes for you. We can use nutrients and herbs, but we got to figure out the right doses for you. We need to make sure your gut health is, because to me, the gut is completely related to vaginal health. And so if we have this virus being able to survive vaginally, then that tells me there's got to be some susceptibility in the gut. We got to look there too. And as we heal the gut, we heal the cervix and the vaginal area too. So we can heal them both at the same time. We need to look at hormones, and we need to look at how we're talking to ourselves and if we're having a lot of negative self-talk, that's only going to just hinder our recovery. These are some of the common supplements you've read about vitamin C, vitamin A, or sometimes you'll hear about beta carotene. Zinc, selenium are good. Vitamin D is a good one, especially because most all of us are low in vitamin D. Methylfolate, and I want to emphasize methylfolate instead of folic acid because a lot of products have folic acid still, and folic acid is an inactive form. Even though the old research used folic acid, now we know better that we need to be using methylfolate, especially because 40 to 50% of us have the MTHFR gene variation. So if almost half of us have definitely a need for methylfolate, and methylfolate's beneficial for everyone, why not use methylfolate, right? So I encourage all of you, if you take anything from this session, is to look at your either multi, B complex, anything that has folate in it, and make sure it says methylfolate, or replace it with one that says methylfolate. We can also use, and there's a long list of supplements. Oh my gosh, what I've done is I prioritize them, and I prioritize them based on reading the research, based on using them with my patients and seeing what works best. I have access with having my doctorate degree, I can access all different supplement companies that only sell to practitioners with doctorate degrees. So I can access higher quality products. I can access different nutrient levels because I'm also trained and certified as a clinical nutritionist. So I can give you dosing that you're not going to get just off the internet or off the product label. And we need to look at, green tea extracts. We can look at mushroom extracts. We can look at curcumin. We can look at DIM. These are some of the most common ones that I find I like to use. And, this is the thing, is I find them one of the most common blind spots in women that I talk to is that they might just be taking a product, which is great. I'd rather you take some vitamin C than no vitamin C. I definitely want to acknowledge you for what you're already taking and doing. But if you could get the right doses, it's going to be way more effective. So that's why I also make it available. Like on my website, you can access, and Andrea can put a link to this product package. This is you can buy them all at once, or you can buy them individually. But this is an example of some of the products that I suggest often when helping to fend off HPV, because we want to have a high quality multi with the right active forms of the nutrients. We want to use, extra. Usually we're using extra methylfolate. This is this 5-MTHF based on how severe the dysplasia is. CCDG is an amazing product because it puts the curcumin, green tea, Coriolis mushroom, and DIM all in one product. So you don't have to have 4 different things. You can put them all in one. And so you can order these on the main website. These we can ship to within the United States. And if you're international and you're listening, we can ship to you. It's just we have to know your location so we can figure out the shipping cost and the customs. And, a lot of times we can ship internationally. So Andrea has also a link you can use to order international, and then we would just, based on your location, we can figure out the shipping cost. And so you can get these already. And I encourage you to, at least start there. But then you might find yourself thinking, well, how much do I need the same regular dose? How much should I be taking? You want to customize it based on your body. And I encourage you to do that. I think being able to customize these doses makes a huge difference. And I want to make sure you don't just put all the focus on the antiviral supplements. Yes, we want the things that are going to give you the nutrients and be supporting your immune system and antiviral. But a common blind spot is that we end up putting too much focus on the supplements and not enough focus on the whole body, because we need your whole body to work for you. And that includes cortisol. This is a cortisol curve showing how cortisol is our main stress hormone, and it should be higher in the morning, gradually decreasing through the day. When we're under stress, this shifts. Our cortisol can go too high, our cortisol can go too low. And when cortisol goes out of balance, it affects all the other hormones in the body. It affects the digestion and increases leaky gut and imbalanced gut bacteria. If it's the cortisol is out of balance from stress, it lowers our immune function. So we become more susceptible to viruses and other infections. It affects our nervous system and our neurotransmitters. So I want you to be able to see, like, this is such a key root cause, an underlying factor. We need to know your cortisol. We also need to know your adrenaline levels so that we can see where you're starting from. And if we see that your levels are too high or too low, I can guide you to get them back to optimal using nutrients and herbs. So this is not, all of this we can address. If you have leaky gut, we can heal that. If you have imbalanced gut bacteria, we can heal that. But it starts by understanding what's out of balance. And this is a diagram I made in my first book called The Stress Remedy, that shows us how if there's leaky gut in the digestion, that then becomes an internal stress on the body. If there's imbalanced blood sugar, that becomes an internal stress on the body. And these kind of create this vicious cycle of inflammation and stress in the body that makes us more susceptible to things like HPV. I mean, this can also, the same pattern can cause all different kinds of health issues. It could cause everything from, fatigue and digestive symptoms like bloating to allergies, anxiety, headaches, migraines. It all comes back to the same underlying causes. So to me, I want to make sure we're addressing this underlying stress pattern. And so I teach you how to get out of what I call stress mode so that we can break those patterns and we can get everything working well again together. So adrenal glands are the ones that make the cortisol and adrenaline. So we need to help. By helping heal your adrenals, we're helping to re-optimize your cortisol and adrenaline. We can heal leaky gut. We can heal the microbiome, both the microbiome in the gut and vaginally. We can rebalance hormones. We can optimize what's called methylation. Methylation is how well your body uses your B vitamins for making healthy cells, right? We want healthy cells on your cervix, vaginal, everywhere. So we need the B vitamins working for you.
Something a lot of people don't know is that too much stress can actually create an abundance of health problems like high blood pressure, high blood sugar, anxiety, migraines, insomnia, even fertility issues. This is because high stress puts your adrenal glands on overload. They release cortisol and adrenaline, which controls your digestion, hormones, immune system, energy, focus, and even your emotional response. So how can you beat stress when you don't know where to start? That's why we have a free 7-day stress reset program. It's designed to help support weight loss, digestive healing, and hormone balancing. It includes support for integrating self-care, daily tips come to you by email and video, gluten-free, dairy-free meal plans, as well as grocery shopping lists, journal pages, and more. This free program will help you beat stress and put you on the path to wholeness in your body. Get your plan now for free at drdani.com.
And so a lot of times I'm suggesting different testing, whether those are, and this is not tending, there's some tests you can get in the regular doctor's office covered by insurance. Okay, let's do that. Let's usually this first thing, we can test certain nutrient levels, vitamin D, they can test, iron, ferritin, they can test, thyroid, they can test, blood sugar levels, that should be covered by your insurance if you have insurance. But what they don't tend to test is cortisol at different times a day, adrenaline, neurotransmitters. This is like serotonin and GABA. They are not going to test. They're not going to do a good test for food sensitivities or leaky gut. These are tests that you can do, but they're from a specialty lab and they're not covered by insurance. So they're going to be out of pocket. It's just something where you start to go, okay, if I need this information, I'm going to need to figure out how to get it for myself and pay out of pocket. And the labs that I work with, these are labs that I've been using and researching and studying for over 2 decades. So you're learning from me. Here's the lab that's going to give you the best information. It doesn't help to spend money on a lab giving you test results that you don't know what to do with, right? We want to have good test results so we can make accurate and appropriate changes based on those results that are going to actually work for you. We can do urine hormone testing, which is sometimes referred to as the Dutch test, which is a dried urine test. And it can measure estrogen, progesterone, testosterone, DHEA, cortisol in a home test. You do at home, a urine home test. And so we can see what's happening not only with your hormone levels, but also detoxification of estrogen, which can play a big role in your risk of abnormal cells and also other conditions in women's health, fibroids, PMDD, fertility issues, menopausal symptoms, fibroids, cancer. So this is information that I encourage all women to get, because it's right now I'm specifically talking about HPV and abnormal pap smears, but this is information that's going to help transform your health overall and, help your hormones get back into balance, your ovaries be working as best they can for you, unless you're postmenopausal, in which case we really are counting more on the adrenals to fill in and help make sure you're, even postmenopausal, you still need to detoxify the estrogen that's present. And we need to make sure, is there leaky gut? Heal it. We can also do stool panel to understand the gut biome and any imbalance in the gut bacteria. So this is all possible, and what I offer through my office. So I want you to know I'm a resource for you. We can do this. There's an example of food sensitivity panel. If you're wondering, yes, you could just decide, okay, I'm going to avoid gluten and dairy. Yeah, great. However, if you're finding yourself wonder, is there another food maybe that's an inflammatory food that's contributing to the inflammation and the susceptibility to HPV? Well, it's really hard to figure out these because these IgG antibodies can last for 3 or 4 weeks. It's not an immediate response. So the way to know if these foods are an issue is to do this test. And it's a finger poke blood test. So we can see, in this example, this person's reacting to dairy, extremely high to egg whites, banana, almond, and gluten. So then we know which food changes to make. Here's an example of that Dutch urine panel I'm talking about, where we can see the progesterone here on the right. We can see the estrogen is way up high. Okay, we need to help get that estrogen moving. It's the high estrogen is in this person's case making them more susceptible to the abnormal cells, but that high estrogen is also going to make them more susceptible to other things too. So we need to handle that before it causes more problems. This one's showing how we can look at liver detoxification of estrogen, and we look at this pie chart and see this person has 18.8% in the red, which is a higher risk detoxification metabolite. And we need to solve that. We need to protect you from that, because that toxic estrogen can make you more susceptible to other health issues. And these things we know how to help with using natural approaches. So to me, I figure, hey, if there's a way to help our bodies, let's give it to them. I also developed this method called CARE, which helps you to really establish a self-care routine that helps your body recover from stress on a daily basis. And CARE includes the clean eating. You could do it based on your food panel if you do the food sensitivity panel. We want to make sure you're getting enough sleep, because so much healing and so much immune activity happens while you're sleeping. We want to reduce your stress or do stress recovery activities to help your body get out of stress, and use exercise or movement to, so these are the things that I teach you to do on a regular basis to help your body keep on staying healthy and healing. And what I found is that more than 90%, I would even say 95% of people who follow my protocol have 100% resolution of their abnormal cells and get their PAP to negative. Keep in mind that we're talking about, these are mostly people who it didn't go away easily for them, right? They had HPV or abnormal cells multiple times. So this is not just, sort of like, the simple cases where it goes away on its own. These are cases where we had to really think outside the box and figure out how to help it go away. And this is where we're getting a very high percentage of success with my protocol to help them resolve the abnormal cells and prevent the HPV from causing abnormal cells all over again. So this is another example case, again, of CIN3, because I want you to see that it can work even on severe cases like CIN3. This one, when she wrote to me, now it's been, I think, another 5 years later, but this is 5 years later, she had her PAP, and it's still dysplasia and HPV free. I like that wording, HPV free. doctors are intrigued, but unfortunately, they don't start implementing any of this themselves. So you really have to work outside of, of the conventional system to get this kind of approach. She's saying, I know I would have faced a much more dire situation if I had not consulted with Dr. Donnie, and I hope this protocol reaches more women. And I love that she has this message of working together as women. Let's work together to educate and help each other heal this and shift this whole pattern. I really think there could be a bigger shift happening where we can change this situation and prevent you from having to go through so much stress. So another common question is, how long does this take? It really can depend on your body and how much you're implementing and your stress in your life. I've seen cases that resolved in 3 months. Sometimes it takes 6 to 12 months. It really kind of depends on your situation, but that gives you a sense of it. We always are going to want to follow up. It's important to follow up and make sure that it was successful, that the results got to negative. I always want to emphasize that. This is not about not doing your conventional care. It's do your conventional care, do your PAP, do your colposcopy. If you need to have a surgery, have the surgery. But then let's do this on the side and then follow up and make sure we're being effective. So another, I'd say, blind spot is feeling like you got to do it all on your own, right? We're so often, I think, told, oh, we're supposed to figure this out on our own. We're supposed to do it on our own. I'm supposed to be a superhero and do this all myself. And so that's why I really want you to know you don't have to do it on your own. I'm here to help you. And I have a team. I have my office. We're here to help. And we've created a couple different options for you. Sometimes I know having multiple options makes it a little confusing because you're like, well, which one should I choose? But I don't mean to. I'm coming from the perspective of I want you to have a couple options so that you can see what's going to work best for you. I really do believe, and I find that, we all have different personalities. We have all different methods that work best for us. Some people really do well working one-on-one, like meeting with me one-on-one. Then you can show me all of your records. We can come up with a plan. I write out a whole plan and strategy for you. We work together over multiple visits as we get test results back. We can really help you along the way. And that's what the one-on-one program is all about. And it doesn't have to start with this, $3,000, $3,200. That's just to give you a ballpark of the overall potential cost. So you have a sense of it. I, again, always want to individualize it. So I would suggest if you want to work with me one-on-one, you would first have a comprehensive initial appointment. That's a 1-hour appointment where we can do our brainstorm and our strategy. So you start with a comprehensive appointment, which you can find if you just go to drdonnie.com and you look under Work with Dr. Donnie and New Patients. You're going to see you can choose the option for setting up a comprehensive appointment. And we allow you to even use my online calendar to schedule that. And we help you to submit your diet and your supplements and your records so that you and I can have a really good comprehensive initial appointment. And then from there, we decide, are there certain tests you want to do? How many follow-up appointments might you need? And that's where, if you add that all together, the comprehensive appointment, any testing, any follow-up appointments, that's in the range of this kind of 3,000-ish. The supplements would be separate. The suppositories are separate, right? Then I created this 12-week program where you're working in a group. You have, and I have it listed here for you. You have 12 video sessions where I'm teaching you each step along the way. I'll show you what those 12 sessions include: understanding your results and understanding HPV, talking about diet changes, all the supplements, how to do the dosing, the suppositories, understanding testing, which testing to do, understanding what your test results mean, including if you do food sensitivity testing, cortisol, hormone testing, understanding how to heal leaky gut, how to recover from stress, how to maintain once you get a good result. So this is all covered in these 12 video sessions. And then we also have 2 live calls per month. So over 12 weeks, then there's 2, 4, 6 live calls where you can interact with me live and ask questions. I also do trainings. You get to interact with the other people in the group. It's really nice. We also get to do meditations and really have conversations about how to shift this whole paradigm and situation with HPV to empower you. It has handouts, it has a dosing personalization tool. It even also has a forum, like a chat forum where you can connect with each other in a private forum all the time, 24/7. You get access to order the vaginal suppositories, because these vaginal suppositories I can't offer just to the public. It has to be under my supervision. So it either has to be by joining the 12-week program or by working with me one-on-one. Then you can order the vaginal suppositories. This program also includes 10% discount on supplements over the whole 12 weeks. So you can order the supplements and the suppositories from my office and get a 10% discount, in addition to getting access to my 7-day stress reset and stress warrior book. So there's a lot you get in this, we call the Say Goodbye to HPV online program. Here's the link. And Andrea, if you don't mind sharing, this is where you can learn more about the one-on-one program. Again, the one-on-one program it's the price is a little higher. It includes the testing, and it includes working with me one-on-one and follow-up appointments. The 12-week program also allows you to order the testing, but they're not included in the cost of the program. So these are some more success cases. I love receiving these where we're like, oh my gosh, my PAP is clear, the HPV is negative. Oh my gosh, it's like we have a big celebration every time we get one of these. And we see these kinds of messages all the time. It's so cool. I love it. So here's the thing is, when you sign up for this program, and it says Sunday on here, but really I would say that's from so within the next 4 days. So if you, because I want to make sure if you're listening to this replay or this recording, but if you sign up within the next 4 days for this 12-week program, you can get $1,000 off. So instead of it being the $1,997, now it's only $997. So here you're getting all the things that I just mentioned. The 12 sessions, the twice monthly live calls, access to order the testing, access to order the supplements and suppositories, plus a discount on the supplements and suppositories. You get all of that instead of the usual price of $1997. You can get it for $997. So that's $1,000 off, and you don't have to. It'll just show on the page where you can get get the 12-week for $997, and this way you can start immediately. You don't have to wait or whatever. You can, as soon as you sign up and do the $997, then it's immediately going to send you an agreement for the program, and then you're going to be able to access right away the first week video session, and you can join us on the next live call. So you don't have to wait. You can immediately start to work on this, immediately get this information. You can, really help get yourself onto this path. You can order the supplements. You can order the supplements already. If you order this whole supplement pack, you can get all of them and it's 10% off. But, sometimes there's different ones you want to add. And I teach you in the program, not just about these supplements, but others that I've found really make a difference for women. So I want you to know not just about these 5, but like everything you need to know. Now that you listened in to the masterclass on how to heal HPV, I want to make sure you know that even though you're listening to this masterclass on the podcast and it's after the fact, when I mentioned that you could get a discount on the 12-week program, I want to make sure that you know you can still have access to that. So if you just go to the link, and I'll provide it below, to the 12-week program, and you go to sign up, if you put in the discount code for HPV 1000, so HPV 1000, then you can still get the $1,000 discount to sign up for the 12-week program. And again, I'm so excited to be able to help you. Please reach out if you have any questions. You can always email my office at office@drdoni.com, which is doctordoni.com. And from there, we can guide you on ways you can work with me to help you get beyond this, get HPV out of your life so you can get it on with your life and everything else that you're wanting to do. So thanks again for joining me, and I look forward to connecting with you at the next episode.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdoni.com.